Welcome to the Chamber Vibes podcast with Guthrie Greater Chamber of Commerce CEO and President Brittany Timmons. You will hear from local guests who will be discussing topics such as leadership, small business, and our vibrant community. You'll also hear success stories and tips from amazing local businesses, dive into important news, meet community leaders, and find out how you can get involved in our community. Here is Brittany Timmons.
Good afternoon, everyone. It's good to be back. We've had a few weeks off from Chamber Vibes, so really good to be back for the podcast. And so today, I'll just dive right in, right? That's what I'm going to do, yeah.
That's what I'm here for.
Right, I'm going to dive right in with today's guest. I have Mr. Bobby Stitt with Mercy Hospital, Logan County. How are you?
I'm doing great.
Good. Well, with Chamber Vibes, I just like sitting down with different chamber investors and talking about your business and why you love Guthrie and things like that. So I know people may be thinking, okay, yeah, the hospital, I know where the hospital is, but you know, there's a lot of new people to Guthrie, and we're seeing that a lot at the chamber right now. There's tons of people moving here and learning, and even I didn't grow up in Guthrie, so there's always new things that I'm learning as well. So let's just dive right in. Let's talk a little bit about the history of Mercy Hospital, Logan County.
Yeah, so, you know, the reality is that Mercy is a ministry. And that's really the beginning of the story for the relationship that Mercy has in our community here in Guthrie. And it's so important to know that what we're doing is about serving that ministry and living that out in our community. And so we do that on a couple of different levels. One is through the hospital, of course, and the services that we provide there. And then, of course, the clinics are the primary care aspect of what we do is so vital. As you know, living in a community that's smaller and rural, even though we're so close to Oklahoma City, Guthrie is considered a rural community.
Right.
And so it's important that we serve our rural customers, our rural family, and that we have a way for them to access quality health care, and that's really what we're about as part of this ministry. And so when you think about the history that's been going on here in Guthrie for over 10 years now.
Okay.
And Mercy owns the hospital. We purchased that from the city and have been running that ever since. And so part of our services there include taking care of emergency room patients, of course, inpatient care, as well as something that we call swing bed. So a swing bed is not a bed that's swinging.
Okay, that sounds a little scary.
Yeah, I know.
Okay.
That's not what that is, but that is.
And fun at the same time.
It is something that, it is fun. But it is something we get to offer to patients who might be in need, but perhaps they've been in Oklahoma City in a larger facility, in a setting there being treated, and it's about time for them to discharge. Okay. However, they would benefit from something like additional therapy.
Okay.
IV therapy, physical therapy, different things that we can offer because of our status as a critical access hospital.
Yes, I'm glad you brought that up because I actually have learned that working with United Way. I actually have learned some new things, and through Leadership Guthrie. So I'll just do a plug for Leadership Guthrie because when you came and spoke to our leadership class, I learned that. So can you talk about a little bit more about what that means?
Yeah, so there was a decision made several years back, probably about 15 years or more, where hospitals in rural settings could apply to be a critical access hospital.
Okay.
What that means is it's a designation, and it centers on the reimbursement we receive.
Okay.
Primarily from Medicare.
Okay.
So we're able to treat, as you know, Medicare, our elderly population. It's oftentimes difficult for them to seek health care, especially outside of their community.
Right.
And so there was this plan that came about for critical access hospitals to be placed in communities such as ours and then be able to provide access and give us the kind of reimbursement it would take from a hospital perspective, because we have such small volumes of patients that we serve. It's hard to make that work without a different structure for payment.
Okay.
Yeah.
Okay. So how long has Mercy Hospital Logan County had that status? Is that a recent thing, or has that been?
Yeah, that was before Mercy took over.
Okay.
And so, as I mentioned, that was something that was brought on. It's probably more like 20 years, I would say,
Okay.
that it's been going on.
Okay, great.
So it's been around for quite a while. A number of our facilities are critical access hospitals, especially in smaller communities.
Okay. Okay. So, talking about, care and everything like that, let's talk about, how many beds or rooms do you all have? Because that's something that people may not know.
Yeah. So physically, we have 25 beds in our hospital here in Logan County, and that, as part of a critical access hospital, you're not allowed to have more than 25.
Right.
So,
okay.
That said, we staff anywhere from 12 to 20 beds that
Okay.
we actually can fill up with our staffing model that we currently have.
Okay, awesome. And then I know something, and hopefully we can get back to this, pre-COVID, when I learned this out of Chamber Coffee, even before I was with the Chamber. But you guys have a really incredible physical therapy center
Yes.
area at the hospital. So can you talk a little bit about that?
I'd love to.
Yes.
We have a very robust physical therapy program there, outpatient and inpatient. So we have speech, occupational therapy, pediatrics, you name it. We're pretty well doing every aspect
Wow.
of the physical therapy realm that you can do. We have a wonderful gym. I think you've mentioned that you're kind of referring to that, that's full of the equipment that we use, as well as special treatment rooms that are dotted around that area. For our patients to be seen one-on-one in privater settings.
That's awesome. So if someone, had surgery in Oklahoma City because it was needed or whatever, but they live in Logan County or in Guthrie or close by, then they can come back home, so to speak, and do their continued care.
That's
awesome.
exactly it.
Very cool. Okay, and so you mentioned the clinics. I know, let's talk. I know where the clinics are, but our listeners may not. So let's kind of talk about the clinics that you all oversee as well in Logan County.
So we do have a clinic that's associated with the hospital. That's just right there next to it, part of the same structure, and it has 2 providers in that clinic that we continue to serve from. Then we also have our clinic out on Division. If you're fully aware, it has a lot of physicians. I think about 11 providers now working out of that area, along with convenient care is seated in that same space there. So very robust area out there. We also have a clinic that's further on out, closer toward Edmond. And
We call that very southern Guthrie,
Yes, we do.
Bobby. That's what we call that.
and a number of providers in there as well. So really robust services right there. Not only that, but we do also have a rural health clinic in Crescent that we serve. So we're reaching quite a ways around us to take care of the community.
Yeah, that's awesome. Okay, so I know, and you and I talked about this before the podcast as well. I know, nobody wants to talk about the year that was, 2020. But obviously being in healthcare, I think it's important that we bring that up and we talk about that. So obviously, spring of 2020, the world changes. So I can imagine, just because even with myself I started this position 2 weeks into the pandemic and I was terrified. So I can imagine being an administrator, how terrifying that was and challenging and what that looked like for you. And so briefly, I just kind of like to talk about COVID, kind of maybe some of the challenges you all faced and maybe some of the ways that you guys overcame those.
Well, Brittany, why don't we start there with what you just said? Let's start with fear.
Okay, yes.
Because that was very prevalent. I think it was the most striking feature, especially at the beginning of this crisis that we've been going through for the last 2.5 years, really. But right at the beginning, I have to tell you, I saw healthcare become fearful.
Right.
And that was different. My background is in nursing, and so I feel very comfortable caring for people in various situations, whether that's an illness or even things that can be contracted from someone. And so we have procedures that we follow for that, and everyone is well versed in those. And yet, there was an element of fear that I've never seen.
Right.
And so we had to break through that barrier of fear with our own coworkers. And so Mercy did a great job, honestly. I'm so glad that we're a part of Mercy, that we have Mercy as a resource to us as a whole, the whole organization, because it really helped us here locally as well. Pushing down the policies that were necessary so that we could manage the care that we needed to provide in a safe manner.
Right.
So vital to us right at the very beginning. That said, right behind the fear came this area or this time period of where we didn't see very many patients, honestly, at the very beginning. People were staying away from healthcare as much as they possibly could. We hadn't fully been engulfed in Oklahoma at the very beginning with what the numbers looked like in the East Coast and the West Coast, places like that. So we weren't seeing the volumes of patient at that time, and that did come later. So when it did come later, where we became very effective and supportive of a broader system of care is through our swing beds. I loved that we have those swing beds.
I was going to say, let's talk telehealth.
Yeah.
Because that's something you guys already had in place.
We did.
But it just grew and blew up even more because that was the way you could serve your patients, right?
That's right. So proud of our telehealth program here in Guthrie, but we actually saw that really take off in our clinics. We were using that in the clinic. We still use that to this day. And then also to see that even in Oklahoma City develop even more in the larger facilities as well. But because we had that here, we were ready.
Right.
And when we needed to take care of patients who were transitioning through the process of COVID, as you know, if you know anybody that's had COVID, it takes a long time to recover. And so guess what? A lot of those patients needed to be swing bed patients.
Right.
And we were able to serve a broad base of our community. Yes, those that come from here, but even greater than that, because we had that swing bed program, and we were able to care for them towards the end of their stay, which helped them get better. And that's huge.
Well, and thankfully you all have the clinics as well, because even I know my family is utilize those services, being the drive up, testing and things like that, being open 8 to 8, you know, and those extended hours and things, and people could get that care or those tests and things that they needed without walking into the ER.
That's right.
And so that, I just think I commend you all for that, because I think that was really an amazing way that you all just stepped up and said, okay, here's how we can provide you. Because I'm sure right in the beginning, people are just thinking they have to go to the ER.
Yes.
Yes.
Yeah. And fighting that urge to go to the ER, and then, it was difficult, but we did a great job of pulling together the resources necessary to, as you just mentioned, see a lot of folks through telemedicine and take care of a lot of those at home.
Right.
So we were able to offer that as well.
That technology is amazing.
Yeah.
I know I've even used telehealth for just a follow-up last year during the pandemic, and I felt safer not having to go to the office, or expose myself or whatever. And I just on my phone just had a video conference, with my PCP, and it was super easy. And I mean, it was great. She asked the questions she needed, and I got the help I needed. And yeah, so obviously those things are still in place, and that will be something that you all just continue to do in a big way.
And get better at.
Right.
And develop even more better processes so that we can help people through every means that's available to us.
That's awesome.
Yeah.
Yeah. So what are, and I'm kind of putting you on the spot here, but everyone will say, oh, Britt, you always do that. But what are some ways that you guys kind of kept up with employee morale, during COVID? Because I'm sure as an administrator, you're thinking, I need people to stay at work. I need them to not leave us. How can we keep people, positive and upbeat as best you can? What are some things that you guys had to implement or try?
Lots of different things. One thing that's vitally important is that we get regular feedback. We get quarterly surveys. We do quarterly coworker surveys where we receive feedback from our coworkers. How are we doing? What are we addressing or not addressing? What are your needs? What are your expectations? And we listen to that feedback, and then we try to implement changes to reflect what they're saying back to us. Oftentimes we find, first of all, the pay gap. That's a huge one that we've all had to struggle with in healthcare, and really I'm sure in other industries right now, that people are just expecting to be paid more. They're looking for that higher value in their dollar. And so Mercy's done a great job of assessing the market, implementing changes. But I loved how Mercy approached this as well, by the way, because we started with our lowest paid coworkers. We didn't start with your managers, and we started with our lowest paid coworkers.
Wow.
And we introduced incentive programs that we continue to use today. We did that with nursing, but we've looked at every department and gone through those and done market analysis, and and remain very competitive with the market. That's the first thing you have to do.
Right.
You owe it to them to do that. And then, like I said, when we do these coworker surveys, the feedback we get is so helpful. They want to be recognized. They want to be recognized for the work that they're doing. So we've had to find ways to do that, whether it's through something that we use regularly. It sounds simple, but it's called a shout out.
Hey, I love shout outs.
I do too. I love shout outs. We do shout outs, and then from that, we'll choose those who've really stood out above and beyond and give them something extra when we hear a story. So we're trying to get the stories back from our coworkers about what they're doing well and getting them noticing their coworker on the side who's doing something well. That makes a huge difference in the morale part of it.
Yeah. Well, and I think the quarterly survey, that's an awesome idea, for you. That shows that Mercy's really listening to the employees, whether it's good, bad, ugly, all of those things. But the employees then probably feel more valued because they're being heard.
Yes.
So I think that's really neat. And I know here in Guthrie, we actually did a program called Guthrie Gives Back the summer of 2020, and we had businesses coming to us saying, hey, I will give X amount of dollars at local restaurants, and that whole night, the tab is on me up to a certain point. And I can't remember the exact week that we did that or anything, but I do remember the one night we did it for our healthcare workers.
Yes.
And so I know that people in the community were just, not that we don't already think that healthcare workers are heroes, but even more so, I think during the pandemic, people really probably got a new awareness and just learned more about truly the kind of heroic things that our healthcare workers do. So,
well, let me say thank you for that.
Well,
I think it's wonderful to share that, and I appreciate that those kinds of things are happening in our community.
Yes, and that was one thing I remember thinking, oh my gosh, I had just taken over the chamber, and we were trying to think of how can we still be beneficial, to our investors and help doing everything virtually. I got to know Facebook Live real well, and so that was a way that our businesses that were giving back, and then we were able to help the restaurants who were also serving during that time, and it was just a really awesome community thing. And we always say #community wins, and those are just those great stories from 2020 that I'm going, that is how community wins, And so talking about how great our community is, that kind of leads me into to Guthrie. So what do you enjoy about having Mercy in Logan County and specifically in Guthrie and partnering like with the chamber and businesses and things like that? What are some things that you just absolutely love about our community?
Well, everybody says this, Guthrie is unique. It really is. It's a wonderful community. It's the history that's here that we all get to enjoy and be a part of and know that I'm connected to this. Even if you didn't live in Guthrie, you're really connected to the history that's housed right here in this community. So I just love knowing that we're a part of that kind of history. And then the vitality here with what you're doing, Brittany, with your predecessor, the people who've really invested, especially through the chamber. I love what the chamber does here. It makes a huge difference in this community.
Thank you.
And I love being a part of that. And
well, we value you. You all are an amazing investor of ours, and always willing. Like you partnered with us on the bed race.
Yeah.
In fact,
hey,
tomorrow,
we won.
I know, which is awesome. Totally not rigged. They had this yellow sports car and took out Custom Dental this year, which was wild. And love Dr. Brown, but there was a lot of people happy to see them not win this year. So we love you, Dr. Brown, if you're listening.
Yes,
we want you to come back next year and try to win it back. But yeah, so things like that. And I know you guys have partnered with just various things. One thing too I want to bring up is that you all have provided free physicals for the schools. So yeah, let's talk about that.
Oh my goodness. Hundreds of physicals that we offer through the division clinic. Rose is the leader there, and she leads that effort for us. And I just love her drive and her ability to pull the team around this every year, and she makes it happen. I know we're getting ready to go to Crescent, I think, is it either this week or next week, to finish up physicals for them as well.
Okay.
And it's huge.
That's awesome. So they just call, make an appointment, and tell them that they're in athletics or that they need their physical.
Yeah.
Okay.
So it's being arranged already. So we will go to
gearing
them.
up for the next season.
Yeah, it's taken care of.
That's awesome. Yeah, that's just, you guys are great. So I know too, like tomorrow well, it depends on, I say tomorrow, it depends on when we put this out there. So I'll say Tuesday, the 17th, you all are partnering with us for our women's luncheon at Meridian Tech. And so we're super excited about that. And so, yeah, I mean, the way you guys give back to the community is just amazing. And you can tell, you love what you do and you're passionate about it. And I think that just exudes in your employees and your staff and the services. And like I said, any services I've ever needed at Mercy or my family, it's been top notch. Yeah. And that's what I want people to really understand, people that are listening or new to town and learning. Like, we have a great hospital and doctors right here in Guthrie. Just because, yes, like you said, rural community, people think, oh, I have to go to Oklahoma City, or the city as we call it. That's not necessarily true. Yes, for certain services maybe, but I think it's important to try to make those phone calls or walk in, get online, come by the chamber. We've got all kinds of info there, and see what services are right here in your backyard, before driving 30 minutes. Yeah. And with gas, who wants to do that anyway right now?
The way I would say it is, let us help you connect to the services that you need. If they're not here, we're going to help you get to where you need to get to be. But this is the great place to start. Right. And that's what we want to do in our community, is be that first, meet that first need that you have. Right. And we're committed to it. We're going to keep doing that. We partner with various agencies. As you know, the Red Cross is on our campus. Yes. We donated a space for them to use. We actually just partnered with North Care. Are you familiar with that?
I am. So I was going to bring that up. So you're good.
They're getting ready to open up a space right next to our clinic on campus for urgent care there. So we're excited about what they're doing and meeting a need, being essential in our community. And we do that, yes, by the services we offer, but also by partnerships. Right. Which is huge.
Well, and you guys are always willing to let Oklahoma Blood Institute, which is another one of our chamber members, and so is the Red Cross. We love having those partnerships, come out and put the blood mobile, and then you all help facilitate and promote, those blood drives. And, I'll just tell you right now, my dad is actually battling a blood cancer, and I kind of had to get over myself a couple years ago when I said, you know what, I'm with the chamber now. I think it'd be really good if I go out and give blood. And here I am, like mid-30s, never have given blood because I was terrified. I did it through OBI, totally got over it. It was totally fine. And now, 2 years later, I'm actually seeing my dad receive donor blood. Wow. And so I'm on that other end of it and seeing that. And so anyway, I always stress how important it is for people to donate blood, but I'm like, okay, now my own father, is being a recipient of that. So anyway, things like that you guys do in the community, having the blood drives and stuff out there is huge too. And that's another way that you guys can serve.
Thank you.
So thank you.
We love doing it. And it's part of our ministry, as I said, and it's what we're going to continue to do in our community. I do want to mention one other thing, if you don't mind.
Not at all.
A little bit of a brag. I'm really excited. So, as you know, our building is somewhat aged. It was built in the 70s, and we continually work on it to try to upgrade it and keep it, in ship shape, I guess is the word I'm trying to say. But we, our emergency department has really been a place that we've needed to uplift a little bit, and we were just awarded some funds through Mercy to spend about $500,000 on some real nice, upkeep of that facility. And so we're looking forward to doing that over the next several months, and it'll be a different look and different experience for folks coming in. And we're just going to be excited to share that with our community.
Absolutely. Onward and upward. That's how we have to keep going. Yeah. That's great. So will you all have any, obviously won't be shutting down the ER, but will you have to kind of change things around a little bit while some work is being done?
We'll do a phased approach, and we'll try to keep a number of beds open in a certain area and kind of move that around as we go through the project. It'll take about 10 weeks, I think, for us to complete.
That's not too bad.
Yeah.
Awesome. Well, that's exciting.
We are
Well, is there anything else you want to add? I know we covered a lot of ground here, and of course, we could go on and on about Mercy because there's so much that you all do. Yeah. But if there's anything else you want to add,
I do have another brag. I will tell you again. We've won this for the third year that I've been here. We're actually named one of the top 20 critical access hospitals in the nation again this year, and so we're excited about that. By the Rural Health Association has named us that, and so we're excited to share that with you as well.
Huge. Well, we're proud of that right here in Guthrie. That's awesome.
This is quality care, and it's happening right here at home where it should be.
Right. Awesome. Thank you so much, Bobby. Thank you for taking time out
Thank you.
today. Thank you for your partnership with the Chamber and the city and all that you do in Logan County as a whole. We really value your services and what you do in your leadership as well. So
thank you.
so much. All right. There you have it. Bobby Stitt with Mercy Hospital Logan County. Thank you again. Hope you all have a great week, and we'll see you next time for Chamber Vibes.